state leaders provide updates on the coronavirus pandemic, many lean on American Sign Language, or ASL, interpreters. Jenny BUECHNER is one of the interpreters Governor Tony Evers and state health officials rely on. Since Jenny is deaf herself, the governor's words are relayed to her through hearing interpreters.
They went to school, they learned American Sign Language as a second language, so they sign what they hear to me. And then I translate it or interpret it even further into American Sign Language. Just make sure that it makes sense to a native American Sign Language user.
Like English, ASL is complex in its own way. A lot of grammatical structure is in the facial expression to convey the message's tone. For example, Jenny says eyebrows go up if there's a question and down if there's a statement, again, depending on the speaker's tone.
Our language is a visually based language. We show concepts, so we're not going to sign exactly the words that are being said.
The state's updates, like most TV programs, are also closed captioned. But Jenny says ASL gives the deaf community an alternative to captions.
And American Sign Language is easier for deaf individuals to understand because we are visually based individuals. That is how we were raised to communicate, visually. We weren't raised to read words, to understand fully what it's saying necessarily. So that's why captions may not be the best fit for everybody.
Jenny keeps up with the news and deaf community organizations to see how they're signing certain concepts for consistency. She even rewatches her signing to ensure she's getting the message out clearly and correctly. When Jenny's not translating for the state, she works full-time as an interpreter for things like doctor's appointments and legal proceedings, and she very much enjoys her work. In Milwaukee, Mary Jo Ola, TMJ4 News.